Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. In this presentation, we are going to look at what makes the human heart beat, what increases the heart rate, what decreases the heart rate, what controls the heart rate. So, we're going to learn all this and much more. So, let us begin with the feature presentation. In order to understand what makes the human heart beat, as you know, the heart sits in the middle of the chest, above the diaphragm, and it has four chambers. But we are going to focus on what is known as the electrical system of the heart. It is the electrical system of the heart which has two different features, namely the generators and the electrical wires. Even though we call it as electrical wires, they are not actually metal wires. These are specialized heart muscle cells. At the junction of the superior vena cava and the right atrium, we have a specialized tissue known as the sinus node. The sinus node generates the impulse. That is, it generates an electrical current. That is conducted through these specialized fibers, or like you can think of them as wires sending the electrical impulse. And these supply the two upper chambers. From there, they come down to a relay station known as the atrioventricular node. Why do we need a relay station? That's a good point. First of all, as you know, the heart beats first, the upper chambers beat, and we have to allow enough time for the blood to be pumped into the lower chambers. And when the blood enters the lower chambers, then the lower chamber beats. So we have to have certain amount of delay between the upper chambers and the lower chambers for the heart to fill the blood into the ventricles or the lower chambers. From there, we have the right and the left bundle branches which supply these electrical impulses to both the ventricles. Now, here's another interesting thing I want to tell you. When the heart muscle contracts to this electrical impulse, it follows the principle of all or none. That is, if the electrical impulse activates one upper chamber muscle fiber, then it is conducted throughout the entire upper chambers. So both the upper chambers squeeze at the same time. That's called the atrial contraction. In the similar manner, the lower chambers, when they squeeze at the same time. That's the ventricular contraction. So we have the atrial contraction, wait, ventricular contraction, relaxation, atrial contraction, delay, ventricular contraction, and relaxation. The other interesting thing is when the ventricles are squeezing, as you can see, when the ventricles are squeezing, the atria are dilating. When the atria are squeezing, the ventricles are dilating. So that's the mechanical part of the heartbeat. But generally speaking, the heart rate is generated at the sinus node, which kind of depolarizes. That means it automatically sends electrical signal. The normal heartbeat is between 40 and 60 beats per minute. So once you understand this mechanism, next thing we're going to look at some of the more common things as what happens to the human heart rate. What increases the human heart rate? What decreases the human heart rate? What is conditioning of the heart rate? And most importantly, can you control the heart rate? That's the thing you really want to watch. So stay tuned. Let's continue with the next question as what controls the human heart rate? The human heart rate is internally regulated. When I say internally, that means you don't even know your heart is beating, or you don't even know that your heart rate is slow or fast. Unless you're like jogging, then you can feel then you can feel your heart beating. But normally speaking, like if you get excited, your heart rate may go up to 120 and you may not even feel it. And that is called the internal regulation. This is brought on by the stimulus from inside the body and from outside the body. Think about the examples like outside the body. If you start jogging, your heart rate goes up because the muscles and the moving body parts send a signal to the brain that, hey, I need oxygen, I can't breathe. So the brain stimulates the heart rate, which increases the heart pumping function and increases the cardiac output to meet the demands of the exercise. That's why when you exercise more than you can really handle, you get exhausted. Not only your heart rate is going 180, 190, you're also huffing and puffing. Eventually, you have to stop to catch your breath. You heard the term. So you have to stop to catch your breath. You have to allow time for the heart to catch up with the oxygen deficit that happens during exercise. So that is the sympathetic response. On the other hand, we have what is known as the parasympathetic response, which is the opposite of the sympathetic response. That is, when you're sleeping, the heart rate goes down. When you're relaxing, your heart rate is slow. Could be 60, could be 50, and in some patients, it could be 40. We have heard that people who can meditate deeply can bring their heart rate down to 40s. There are other conditions that can decrease your heart rate, which we'll talk about in a minute, but the parasympathetic system acts in the direction of slowing your heart rate, whereas the sympathetic system increases your heart rate either to meet the demands or even when you just get anxious. There's no increase in demand, but still anxiety can increase your sympathetic response. As a result, it's called the fight response. That's when your heart rate goes up. A whole host of other conditions can also increase your heart rate. For example, irregular heartbeats like atrial fibrillation, which you probably have heard, that can increase your heart rate. Not only can it increase your heart rate, but it also changes the rhythm from beat to beat. So it is irregular tachycardia. Tachycardia means rapid heartbeat. Bradycardia means slow heartbeat, a heartbeat less than 60 per minute. Now let's get back to the next question. What decreases the heart rate? The most important thing we should keep in mind is medications. Beta blockers can decrease the heart rate. Other medications like clonidine, alpha blockers can decrease your heart rate. So if you're on medications, you need to check your pulse. When you check your blood pressure, you need to monitor your pulse also. If it drops below 60, you should get concerned. You talk to your doctor. But it is not uncommon for people who are on beta blockers to have their rates in like 40s, 50s, if they can tolerate it. And the next question is, what is conditioning of the heart rate? The heart rate is to a majority of the time controlled internally by the signals coming from inside the body and outside the body. I talked about outside the body when you exercise, but internally, like if somebody is hemorrhaging, then the heart rate goes up because they are not exercising, but they are losing blood, they are losing their oxygen capacity, and that increases the heart rate, and a whole host of conditions like fever, which can increase the heart rate. And what are the conditions that can decrease the heart rate? Like a fear. When you have fear, your heart rate slows down, your blood vessels dilate. That's why people feel like they are going to faint. Okay, let's talk about conditioning of the heart rate. When you exercise for the first time on a treadmill, your heart rate response can go from 60 to 120 within like 1 or 2 or 3 minutes. But as you continue to exercise, the heart and the muscles understand the demand that it is getting. As a result, the body adapts itself to this mechanism whereby the heart is just not jumping the rate Heart rate is not jumping immediately when you get on the treadmill. And as you exercise over and over again, the body gets conditioned so that the heart rate response is going to be much less after 6 months of training compared to when you started with. That's exactly what happens in athletes like marathon runners or basketball players. Their heart rates are in the 50s normally or 60s, and even when they are playing vigorous sports, their heart rate may not go more than 80 or 90 heartbeats. That's because they have conditioned their heart rate with many hours of exercise on a daily basis. As a result, two things happen. One, the hormonal changes in the body make the heart rate response less compared to an untrained person, and also their heart chamber enlarges to increase the amount of blood it can pump with each heartbeat. Finally, the most important question is, can you control your heart rate? Like when you're getting anxious, when you're sitting there for an interview, then you get anxious and your heart rate goes up. Can you control that one? Or when you are excited, or when you're angry, you see your heart rate pumping. Can you control that? That's the most important question. Yes, to a certain degree, you can control your heart rate. But before we can control the heart rate, we need to control what is triggering the heart rate. If it's anxiety, we can do certain things like meditation or relaxation exercises or training that will help to control the heart rate. That is, if we control the anxiety, that automatically controls your heart rate. And as I said, even physical training will help to keep your heart rate lower under these circumstances. Like you have heard, like the rishis in India who used to meditate for days and months, their heart rates would be like 30s or 40s. Yes, indeed, we can control that, but we have to make a conscious effort to first practice meditation, which is one of the things. The second thing is to reduce whatever is triggering that increase in heart rate to begin with. I hope this has been educational to you. If you would like me to explain any other features related to the heart, I will be more than happy to. I've been practicing cardiology for more than 40 years, and I will be delighted to create another educational video. And please do subscribe to our channel. Thank you so much.